Hello, my name is Rosita Phol. Thank you to my teachers for giving me the opportunity to share my experience in Nepal with all of you today. This man has cataract. You can see that his left eye is completely white. This is due to the lens becoming opaque because of aging or illness. Cataract is a major cause of blindness, accounting for 50% of the blindness experienced worldwide. Cataract increases morbidity, mortality, decreases the quality of life, and increases family and social dependence. The good news is that cataract can be cured by a small procedure, just a small incision of 5 millimeters into the cornea to take out the old lens and replace it with a new artificial lens. The procedure takes between 8 to 10 minutes. My journey to Nepal began in September when I volunteered to go along with the People's Eye Care Foundation to Sawankalok district in Sukhothai, the ancient capital of Thailand. A total of 103 patients came for surgery with the camp. And whilst they were waiting in queue, I randomly selected 5 patients and conducted an in-depth interview with them. I wanted to find out why they had waited so long for the foundation to come to get their eye surgery done. Why had they not gone to the nearby government hospital, which was only 20 kilometers away from their town and was free? Well, a lot of the patients gave the same answer, and 3 main barriers emerged. Firstly, they could not afford the cost of transportation. Even though fact-finding showed that public transport costs only 100 baht, a lot of these patients had no jobs, and their only source of income were government see-now subsidies of 800 baht per month. Secondly, going to the hospital would involve multiple visits before they would get their surgery done, and a long waiting time. Again, fact-checking showed that it would only have required 2 visits and that 100% of the surgeries were completed within 3 months. Lastly, the patients claimed that clear vision was not of importance to them, since they did not have to work and make use of their eyesight. So we concluded that even when governments provide free operations, a lot of these patients still could not access the treatment because of a lack of social and family support to send them to the hospital. This is my thesis, which I submitted to the Royal College of Ophthalmology's journal, and it caught the eye of 2 senior professors who invited me to conduct the same research in Lumbini province, Nepal. And without hesitation, I said yes. On the 7th to 14th of December 2022, the cataract surgical camp was organized by the Royal Thai Monastery, Prasi Bodiwet Abbot, the Royal College of Ophthalmology, Thailand, and the Tinganga Institute of Ophthalmology. Dr. Sanduk Ruit is a world-renowned ophthalmologist who operated more than 200,000 patients with cataract. He also produces lens for $3, which he sends to Africa, India, and Bangladesh. These groups of people came together and organized this camp in commemoration of the late King Bhumibol Adulyadej of Thailand. I was also fortunate enough to join the Mobile Dental Operation Camp. This is Nepal. It was very cold there, and we went to a small province called Lumbini, which is where Buddha was born. The program was announced by TV, radio, and loudspeaker, which is how the people of Nepal and nearby districts heard about the free cataract surgery. This is the queue for registration, and I was surprised to see that every patient was accompanied by 1 or 2 of their relatives. The screening process was conducted by Nepali doctors, and there were a total of 820 patients scheduled for cataract surgery over the course of 4 days. The monastery building was turned into an operation room, and the waiting area was a tent outside the building. This is the place where the patients would change their dresses and get ready for their operation. There were a total of 8 Nepali doctors and 8 Thai doctors who took turns giving the surgery. There were 6 operation beds, and there were around 200 patients having surgery per day, and each surgery took between 5 to 8 minutes. The quickest surgery was by Dr. Sanduk Ruit, who took a maximum of 5 minutes per patient. After the surgery, weight was placed on the eye so that the wound would close and that the lens would stay in place. This was done for 1 hour. Then the patients were rechecked before they were sent to the sleeping area, which the monastery provided. This man had heart disease, and that's me holding the portable echo machine. This is the sleeping area, as well as the free food provided by the temple. As you can see, the relatives were always with the patients. And now, the day that we've all been waiting for, which is the day after the patients have their surgery and would open their eyes and be able to see again. Take the man on the left. He had 2 eye surgeries. Now, he would be able to see a lot more clearly. It was during this time that I interviewed 80 patients with the help of a local Nepali translator. Here is the questionnaire I used. And I also helped check the pupil size and to make sure that the lens was in place. We also conducted some eye tests on the patients. And by far my favorite part of the whole trip was when the patients gained their eyesight back and began dancing with happiness. Let's take a look at the video. I was also fortunate enough to meet Dr. Sanduk Ruit and Prasi Bodiwait, who were both interested in my project and gave me a lot of good life advice. Here is my thesis, which I will submit as part of my EPQ project. I interviewed 80 patients to find out what the barriers to access to cataract surgery were. There was only one barrier, and that was that they could not afford the cost of the surgery. All other barriers were manageable because they had strong support from their family and from society, especially from their sons and daughters, who would take the working day off to send their parents to the camp. There was also strong support from the Thai temple. So whilst in Sukhothai, the barriers were transportation, multiple visits, and long waiting time. These were not found in Nepal. Lastly, the Nepalis valued their eyesight because they have to make use of it in the house and on the farms, which requires good eyesight. I was also fortunate enough to join the first international dental clinic organized in Lumbini, Nepal. That's me helping registering the patients and monitoring their blood pressure. I also interviewed the Nepali doctors, patients, and local Nepali authorities and wrote a paper on the camp, which is currently being considered to be published in the Mahidol Journal of Dentistry. This is the extraction process. So what did I find? Well, I found that a lot of the patients used bamboo stick to brush their teeth, and many of them viewed brushing their teeth as a cosmetic. A lot of them chewed tobacco, and more than half had never once been to the dentist in their life. Before I end, I'd like to briefly talk about Nepal. Nepal is a landlocked country located in between two global superpowers, India and China. It has no access to the sea. Nepal is cursed by natural disasters like earthquakes, and most of its land is covered in mountains. Political instability caused by the massacre of the royal family in 2001 and unstable government has made economic planning not continuous. HDI values are incredibly low. Look at the roads, they're full of cows. There's also a lack of electricity and water supply. They lived as we did hundreds of years ago. This has all formed a part of another important project I'm working on, which is writing an economics book. My trip to Nepal is one of the chapters. Lastly, I'd just like to show some of the photos of both the good and the bad times I faced whilst in Nepal. This is me struggling to get some water, and I also got lost in the middle of the forest. But thankfully, this kind gentleman came to my rescue. And I also had some great times, made some great memories, and met some great people whilst I was there. Thank you for listening.